Good afternoon, Hoosiers. Thank you for joining us. We'll get right at it. But first, welcome back, Dr. Box. I know it was just a matter of days, but it felt like a long time from my perspective. And thank you for still remaining in touch every single day, even as you were recovering. Hopefully, you'll be able to give us a little snapshot of what it was like going through that recovery at home, and also you'll be giving us an update on our targeted approach into the 534 long-term care centers and that whole program that's rolling out as we speak. You will also all see later today in Dr. Box's comments as well that we're seeing COVID-19 spread in virtually every community, every county at different levels, and this will also help explain why we are taking this targeted approach into our long-term care centers. We see that 69% of COVID hospitalizations are attached to people who are 60 years of age and up. Specifically, 47% of them are of age 70 and older. And it's just critical that we can do everything that we can to help bring that number down, obviously not just to save lives, but to also to save valuable resources as well. Our hospitals are under a tremendous amount of pressure, and we know that, again, we're going to save lives, but also that we're going to be helping things up and downstream as we target our efforts and our resources to help drive down those hospitalizations and while protecting our most vulnerable. You will also further explain how we're progressing in those steps, along with Adjutant General Dale Lyles, who is also with us, and he's in a different room, but due to modern advances in technology, he'll be able to join us live as well and talk about the over 1,300 men and women in uniform serving in the Indiana National Guard and how they'll be deployed on Monday, November 2nd, out to these ultimately 534 long-term care centers. And that just, I'd be remiss if I didn't thank those folks who are wearing the uniform. We ask them to do so much, so many different things, never done before this year. But the answer is always yes, and they're always stepping forward into the gap. And I just want to thank them and their families. Their families are making tremendous amount of sacrifices as well, and the business community, because these folks have other jobs and they're stepping away from those as well, fanning out all across the state of Indiana. And then, as overwhelmed as those staff members are at our long-term care centers, so are our healthcare workers in hospitals, et cetera. And we just want to say thank you for all that you're doing as these rates continue to go up and morph and move around the state of Indiana. You two are answering the call, and I know you're exhausted, but we're here to continue to partner with you and make sure that you continue to get the resources, as we were doing months ago in the 534 long-term centers, getting them the PPE that they needed, and then we just sent a whole lot more, 2 million masks. So with that, we'll go directly to you, Dr. Box, and then we'll get to General Lyles.
Thank you, Governor. Good afternoon, Hoosiers. It's good to be back, and I want to thank everyone who sent their thoughts and their prayers to me and to my family throughout this past couple of weeks. It's really been amazing that we recovered, all of us, as well as we did, and we all feel fully recovered at this point in time, and I'm incredibly grateful for that. I'll confess that it was a bit surreal to be isolating at home and having my family needing to be quarantined or isolating at the same time. It's one of those things that we talked about but didn't really imagine happening to us, and it did. When I learned that my grandson and my daughter were symptomatic and that they'd been exposed to positive workers at the daycare, we all immediately left. I left work, they left, and went immediately to be tested. And when I got the results, I worked with our state epidemiologist on contact tracing, and I made sure my family was aware of their need to isolate and to quarantine. Under CDC guidelines, my positive test result on October 14th meant I needed to self-isolate for 10 days because I didn't have any symptoms at the time of my test. but that meant my isolation would have ended on Saturday, the 24th. However, I did develop some mild symptoms on the 15th, and that extended my isolation until Sunday, the 25th. My symptoms resolved, and I was able to return to work in person on Monday. I did not get retested because the CDC does not recommend testing as a way to get off of isolation. Some people can still test positive even after their symptoms resolve. It doesn't mean that the viral particles there are replicating and that I could be infectious of someone else. In these cases, people cannot transmit that virus any longer. It's more important to complete the quarantine or the isolation period and to have your symptoms be gone for at least 24 hours, specifically for sure a fever, without any use of medication. Quarantine and isolation are not convenient. I'm fortunate that we have enough space and I was able to isolate from my husband for the most part. Although I think he is happy that I am back at work, so he does no longer have to be my IT individual at home. During my isolation, I was very fastidious about socially distancing, washing my hands, wiping down surfaces with disinfectant. We canceled any regular appointments that involved people coming to our home. A family friend went grocery shopping for us, and neighbors left things on our doorstep. So far, no one but myself, my daughter, my grandson, and my daughter-in-law have tested positive, and everyone is recovered. I'm convinced that taking these steps helped me make that possible. I feel blessed that our family has weathered this disease as well as we have, but many Hoosiers I know are not that fortunate, and that's why I want to focus today on the troubling increases we've seen over the past couple of weeks. Our 7-day positivity rate is 7.1%, which reflects the recent increase in cases. Our hospital admissions also have increased significantly. The number of people hospitalized for COVID yesterday was 1,679, which is the highest that we have seen to date. We continue to see more than 100 people a day being admitted with symptoms of COVID. We're talking to our hospitals, our preparedness districts, and individual counties regularly to identify their concerns and see what we can provide to them in the form of help. We talk to the North, the Central, and the South hospital systems twice a week. These discussions focus on patient counts, ICU and ventilator capacity, staffing concerns, PPE, and testing supplies. Our hospitals are more nimble now than they were in April, and they've already demonstrated that they can get creative and build ICU capacity. We simply know more about how to handle this than we did at the beginning. At this point, the hospitals still have the ability to adjust for a surge by working internally to get creative with staffing and externally to transfer patients as needed so that Hoosiers that are ill can still get the care that they need. I also want to note that almost 70% of the people who have been hospitalized this month were those ages 60 and older. While COVID has taken a bigger toll on our elderly Hoosiers, this is the highest percentage since the start of the pandemic. This is the population that often resides in our long-term care facilities. We also know that about 56% of COVID deaths in Indiana have occurred among residents of long-term care facilities. These are the reasons we are bringing in additional resources to assist these facilities. As Dr. Weaver mentioned last week, those resources include infection control training with additional surveys, the distribution of more than 3 million pieces of PPE, and engaging the Indiana National Guard to help with testing and infection control. As of last night, about 50% of the PPE orders had left Langham to head for long-term care facilities. We continue to work to ship the remaining orders in the coming days. General Lyles is here and will share more about the Guard's involvement shortly, but I want to mention that we have been in contact with the long-term care associations, and they have been very appreciative of the additional help that we are sending. We also have reached out to the Healthcare Reserve workforce that we established in the spring in partnership with the Bowen Center. We plan to hire about 50 clinical staff so that all long-term care facilities can be visited at least 3 times a week. So far, we have identified more than 40 individuals who are interested in serving either full-time or part-time, and we continue to recruit additional candidates. If you know of someone who's interested, please have them reach out. As we have seen more cases across the state, we are also seeing more testing. In the early days of the pandemic, our capacity for testing was measured in the hundreds each day, not in the tens of thousands we are seeing regularly today. Our testing capacity as a state is the highest that it's ever been. We have almost 280 testing sites around the state. That includes 69 community testing sites run by local health departments and 34 sites run by OptumServe, as well as the weekly drive-through clinics the State Department of Health holds. Our local health department sites have done more than 59,000 tests since September the 1st, and our Optum sites are closing in on 400,000 tests. This is a dramatic improvement from where we were in April when testing was still very limited. We also continue to add staff to the centralized contact tracing center to help with the increased volume of cases. As of today, there are 847 contact tracers in our centralized operation and another 379 in local health departments. Some of our summer contact tracers returned to school or to their jobs. We're in the process of adding 300 people this month and have plans to do the same for November. We're adjusting the schedules of staff on demand so that we have ample staff on hand for those high-volume days. We're also working to shorten the contact tracing interviews and reorganize the questions so that we reduce the time that contact tracing takes. And we're looking closely at which cases we can defer to local contact tracers. This could include universities that have partnered with their local public health departments and are doing a great job. Many states are facing similar challenges as cases increase across the country. But even with these challenges, we have come a long way from where we were in April. Back then, the job of contact tracing fell solely on our 95 local health departments. Many of them already had very small staffs and lacked the capacity to simply take this task on. Others have closed their doors to many services and were just unable to handle the volume coming their way. Please, if you get a text or a phone call from a contact tracer, take the time to answer the questions so that we can protect Hoosiers and bring these case counts back down. I also want to look at our color-coded county map. We have 3 counties in red this week. Dearborn and Ohio counties are in red for the second week. I've reached out to the local health officers in both of these counties to discuss the transmission in these counties and the recommendations that have been outlined for our counties that are in red. We have recommended that they take steps to control the size of events, establish guardrails to help bring down this transmission. We'll be keeping a close eye on these counties and will take further steps if needed. Finally, I have a brief update on the COVID-19 vaccine. We have been told by the federal vaccine coordinators to expect some doses of the first vaccine by late November and possibly a shipment of the second vaccine in mid-December. We do not know how much Indiana will receive yet, but we expect the supply to be limited in the beginning. The vaccine plan that we submitted to the CDC calls for initial doses to go to healthcare providers and other vulnerable populations. We have a team of internal and external partners that continues to work on our allocation plan to ensure that we are able to move the vaccine quickly once it arrives. We also have a team that will review the data to determine the populations in which the vaccine has been tested. This is a rapidly developing situation, so a lot is subject to change. But I want to emphasize is that this is a widely available vaccine to all people of all ages is still months away. So keep wearing your mask, washing your hands, and practicing social distancing. They're the best tools that we have right now, and we need to use every tool that we have to get our cases back under control. Thank you.
Thank you, Dr. Box. We will now virtually and live go to General Lyles. Are you with us, General?
Yes, sir.
Perfect.
I am.
The floor is yours.
Thank you, Governor. And Dr. Box, it's certainly glad to see you back in the fight, and your presence is reassuring to all of us. So I'm Brigadier General Dale Lyles, the Adjutant General for the Indiana National Guard, and today I'm going to talk about our response to assist healthcare providers within long-term care facilities. Hoosiers will soon see additional support in long-term care facilities across the state from Indiana National Guardsmen. Guardsmen are deploying to help prevent infection in their communities. At the direction of Governor Holcomb on November the 2nd, the Indiana National Guard will mobilize teams of guardsmen to 133 of the state's hardest-hit facilities. Oversight and assistance will be provided by the Indiana Department of Health and National Guard medical professionals. The National Guard will then broaden its support to all of Indiana's 534 long-term care facilities over the next 3 weeks. These soldiers will assist nursing home staffs with infection control measures and monitoring, COVID-19 prevention checklists, data entry, registration for testing, and staff and visitor screening and wellness checks. Indiana National Guard troops are well-trained and ready to assist with keeping long-term care facility residents and staff members safe and protected during this health crisis, just as we do during other types of domestic emergencies. Our citizen soldiers and airmen who serve close to home know and support their communities and their neighbors. Guardsmen are being trained by professional staff from Proberry, a company working with the Indiana Department of Health to teach frontline workers infection control measures to reduce unnecessary transfers of COVID positive individuals to hospitals. The training is taking place this week at Camp Atterbury. There will be 2 training sessions on Friday to allow for social distancing. Prior to placement in the facilities, all guardsmen will receive a COVID-19 test, and during their assignment, they will be tested and monitored regularly. The State Health Department will provide guardsmen with scrubs and personal protective equipment, including N95 and surgical masks, gloves, goggles, and gowns. The mission will continue till on or about December the 31st. Our current Indiana National Guard engagements include testing site support, food bank support, Indiana Department of Corrections support, and earlier in the pandemic, the Indiana National Guard supported testing efforts, Fairbanks study, long-term care facility testing, medical augmentation within the Department of Corrections, and planning for alternate care sites with the deployment of a medical augmentation packages. Indiana National Guard personnel will directly support long-term care facility director as augmentation of the staff. Duty-related questions and facility-specific questions will be addressed directly within the facility director. Service members will also have a command team they will report to that will be coordinating with designated health department and Proberry representatives to address any specific scope of work questions or any other concerns. I would just like to echo Governor Holcomb's remarks that we certainly do appreciate all of the Indiana employers that are allowing for the quick turn on guardsmen to deploy during this time of a medical emergency. Certainly do appreciate all of that. Thank you.
Thank you, General Isles. And before we, Rachel, go right to the Q&A, I just thought, Dr. Box, you talked about the 3 red counties, Fayette, Dearborn, and Ohio. Mm-hmm. You want to just briefly talk about how we're in constant communication well before you get a red, and we're in constant communication when you're in red for a week or 2, hopefully not 3. Mm-hmm. But even with the orange, and while we're happy that some are blue, and we want more to be there, it starts well before that this dialogue is occurring.
Right. So that's a great question, Governor. And we, I would say Dr. Weaver, myself, but very importantly, our state epidemiologist, Pam Pontonis, are in constant contact with webinars with the local health departments, but then talking directly to the local health officers to make sure that they are aware of the different recommendations depending on what color their county is in that particular week. And I have specifically reached out this week to the 2 local health officers in the counties, Dearborn and Ohio, that have been in red. Now this is their 2nd week. I was really pleased to hear the engagement that they've had, not only with their local superintendents, but also with their local elected officials and other public health people there in their counties. They had already talked about the fact that they were either out of the sectionals or that maybe they didn't have a football team, so that wasn't an issue. They had talked about limiting the size of their particular events that were coming up, and realized they really walked me through what events they had and that they didn't have big events coming up. They talked with their superintendent specifically about the need to be able to make sure that students were being quarantined and isolated and being tested, and then specifically that after-school activities and other assemblies and engagements probably needed to be canceled or limited at this point in time. Really, both the local health officers were very actively engaged in this process of making sure that their community knew how they could respond. I did also offer help from the state level with anything that they might need, further education, or even support if they have particular businesses that have signs posted about wearing masks, but people just aren't following that recommendation, that we could help from the state level to kind of come in and educate those particular businesses or facilities.
Thank you. And I should also note that Dr. Dan and Dr. Weaver are with us as well virtually. They're in a different room, but they'll be available too. You want to hit the Q&A portion now, Rachel?
Yes, Andrew Smith, WRTV.
Afternoon, Andrew.
Good afternoon. My question is in regards to the rise in the number of deaths that we've been seeing the last couple of days, as well as the cases. Are we noticing any specific trends as to why that might be, or specific areas that those are coming from? And then what steps are being done to help reduce those numbers?
Yeah, well, that's just what that's what we're doing right now with, if you look at the 33 deaths today reported and 51 the day before, and the number and the percentages, while they're all not, I want to underscore, while they're all not in our long-term care facilities, we know that many are, and we know that that also then overwhelms our hospitals. And so that's why the Indiana National Guard in these 3 waves will be sending out over 1,300 people to assist in our long-term care centers. And that's what we're tracking every day. And when you get a report of total deaths and the number of who are the most vulnerable, who have, underlying conditions, you said this, I've repeated this 2 or 3 times, you said this at the very first press conference we had, was that we were going to have to look at the most vulnerable among us and where are they. But we shouldn't also, and then I'll lateral it to you, we shouldn't also take our eye off the ball of where this is spreading in every age group. And so while it is more likely to be fatal to folks who are 65, 70, and older, it's also being spread to them by someone else. And so that's why we're all in this together, and that's why it's up to us individually to be promoting all the best practices that will have a positive impact downstream. You want to talk about any other common denominator?
Yeah, I think your point is well made, and that is that we are focusing on that highest risk, most vulnerable population to make sure that we can protect them, keep them safe, get them care if and when they do get sick. But I think also importantly, we do, as the governor says, we need to look at the population that's bringing this to these individuals. And I'm especially concerned as we look at the holidays that are coming up, where we all want to be with our families, and the concern that those 20 to 30-year-olds may bring that into the home. The CDC was with us recently, Dr. Birx, and she threw out there that there's some evidence out there that about 80% of 20 to 30-year-olds remain asymptomatic, that they can be positive and be totally asymptomatic. And we've always looked at that for the general population at about 40%. There was also recently from the CDC and MMWR where they actually looked at and surveyed every age group about their thought processes with regards to different mitigation procedures like washing your hands and social distancing. And guess which age group really didn't buy into that whole wearing a mask, that 20 to 30-something age group. So we need to continue the messaging there and really reach out to those group of individuals. And I think our universities have done a really good job, but there's still a large group of individuals in that age group that are now out in the workforce, right? But enjoying their first jobs and their first freedom and the ability to go to bars or restaurants and to socialize.
And Andrew, I would also say that your question reminds me that our job is never ending, and that we need to continue to make sure that we get the resources to the folks that need it. And that's the example of sending another 2 million N95 masks to long-term care centers and to schools. But we want to make sure that the staff, those frontline folks, have the good stuff. And we've sent. There was a previous wave where we sent PPE out to gowns included and face shields. But this is also something that we'll continue to do is, and that's in these conversations that you're having in each of our health districts, all 10 of them, we're in constant daily communication with all of our hospitals and our local health departments, learning what they may need right now, or we're being proactive, not just reactive. And in the very beginning, we were reacting as this was really cresting. Now we're being very proactive, and that's going to help us manage our way through it.
Rob Burgess of the Wabash Plain Dealer.
Good afternoon, Rob.
Good afternoon, Governor. Good to be with you again. Good to have you back, Dr. Box. I'm glad you're feeling better.
Thank you.
First question is for you, Dr. Box. Yesterday, the ISDH and the city of Wabash opened a free clinic for COVID-19 testing due to rising local cases. In today's update, Wabash County had 30 new cases and 132 new tests, and that's the most I've seen for either number. And if you take just those single-day figures, that's an over 22% positivity rate. How many of those tests and positives in the latest report are from that clinic alone? And what are you finding there? And how is that in keeping with other clinics that you've set up around the state in similar situations?
So we do look at positivity at different sites, whether that's an Optum site or whether that's a local health department site. I'm so sorry, but off the top of my head, I don't know exactly how that compares to where Wabash was before. I will say that oftentimes when we go into a county with one of our ISDH teams to do testing, it is because there's either a lack of testing there or there is an outbreak and a number of people are symptomatic and need and want to be tested. So that is, expected that we would see those higher positivity cases. But that's certainly something that we share with our local public health also to make sure that those individuals that are in public health know what their positivity of their sites are and they can respond to that.
Did you have a second question, Rob, or did you just drop?
Oh, yes.
Yeah.
And the second question was for you, Governor
Sure.
Holcomb. State election officials have said how fast votes are tallied will depend on how many absentee ballots are received, which from what I'm hearing, there's a lot this year. And the final results may not be available until after Election Day. I've heard you say before that you'd prefer it to have a result by Election Day and not have it go past that. And
That's what I
President
like.
Trump has said similar things.
It may not matter what I like.
Well, fair enough.
I mean, I'm encouraged by the turnout, by the way. This is a good thing.
Absolutely. What is your opinion on how long the state should be allowed to count ballots after Election Day?
Well, they'll count them. They'll count all of them that qualify to be counted. And the point that I've made previous is that the sooner the better. You can't sacrifice the quality of the job, and you need to be thorough, and it needs to be accurate, and that gives Hoosiers the confidence that their voice was not just expressed, but that it was taken into account. So this is obviously, in 92 different counties being handled. And the important point that I want to make sure that I convey is that the Secretary of State said and provided the PPE to all the county clerks so that we can conduct safe in-person elections. And what we're seeing is a large number have voted by absentee and are voting by absentee ballot, and many are voting early. And again, I think that's a good thing. The more people that vote, the better. Now, what we'll probably see is when you get some of these counties that have already voted 40, 50, 60% before Election Day itself, then maybe the lines won't be as long on Election Day, which was maybe the counter to in years past.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon, Governor. Good afternoon, Dr. Bucks. Always good to have you back, good doctor.
Thank you.
Governor, a couple questions, particularly for you. One goes to voting. With the long lines that we've seen, 7.5 hours some places in Marion County, should we have done the no excuse mail-in absentee balloting as a way to protect from COVID-19? And my second question for you, Governor, is over the past 7-8 months, is there anything that you would have done differently, just sort of looking back in retrospect? Maybe not move to one stage a little bit faster than the other, or maybe put out more PPE, anything you would have done differently as you look back in retrospect?
I think I'll take your second question first, and you can correct me if I'm wrong, but that book will be written later. We're focused on the carrying out the order of the day every day. And obviously, yes, we are learning along the way, and we are partnering more than ever with folks at the local level, around the state, and our federal partners as well. But we're all in this together. And one day maybe I'll have a book in me and I'll look back and say woulda, coulda, shoulda. But right now we've got a great team on the ground 24 hours a day. Your first question was no excuse. No, we're proving that it is safe to vote. And there were multiple options where, we started 28 days prior to the election day. You're seeing we've been doing tracing on this. I haven't seen any reports come across my desk that are tracing back to lines. Folks are, from reports that I get, taking this very seriously. And you should, when you're in line, mask up. You should be physically distanced from one another if they're not in your family, and do it safely. And again, at record numbers, we're proving it could be done.
Steve with KPC Media.
Afternoon, Steve.
Good afternoon. How are you doing today?
Really good. How are you?
Good, Dr. Box. Glad to see that you're back and feeling better as well. I had a question today. Was wondering, throughout the summer, we saw some good progress coming out of the spring. Things held stable. Numbers were improving. We had some ups and downs, but overall, things were pretty good until they've kind of gone off the rails here in the last month. The question that I had somebody ask me was, is there any evidence that cold is maybe helping lead to a resurgence here? I know kind of some of the prevailing thought has been just more people are being forced indoors where maybe it's more likely to transmit, but I was wondering if there's any evidence about weather having an impact.
That's a really good question, and actually was the question that we posed to our research team that we work with on a regular basis, and they recently sent that out. The literature and the experts are pretty divided on that. Some people think that the colder weather actually does allow those particles to hang in the air longer and to not dissipate the same way. Certainly, if you don't have a nice breeze, that can be a part of that too. Bringing it inside is probably the biggest concern, and then it's all about what type of ventilation you have and how often that air is recirculated inside. So I think that's still yet to be determined based on the recent information that I looked at.
Sherry from the Indianapolis Star.
Afternoon, Sherry.
Good afternoon. I have two questions, and I think they're probably both for Dr. Box. One is I'm hoping you can elaborate a little bit more on anything you know about the vaccine, when a new vaccine, when the vaccine, who might be, what company or companies might be doing the vaccine. I gather so far nothing's been FDA approved, so and we've seen a lot of trials start out promising, and then something has happened and they haven't been as promising. So any more you can tell us about what you've heard about the vaccine and from who you heard it? And then the other question is, I'm wondering, given again that most of the evidence is showing that the spread is happening in smaller gatherings where people are letting down their guard, what, if any, interventions actually help to prevent that type of transmission other than people getting the word, which they don't seem to have done despite everything all of the media has been trying to do and you guys have been trying to do to that effect?
Sherry, it's a great question, and it's a really difficult question for me. Obviously, with my family, that's been my social bubble, and I let my guard down there. I don't wear my masks all the time, or usually any time that I'm in the house with them. I have been known to grab my grandson and give him a big kiss and a hug, and that's just part of who I am. But that's going to be, I think, what is going to really continue to increase these cases, and especially around the holiday time concerns me the most. So I would say that, as we look at these particular times, we need to protect especially those individuals that are most vulnerable. Those individuals that are over the age of 60 to 65 have underlying health conditions. Those individuals that are younger that have underlying health conditions like obesity or diabetes or asthma or other things. We really just have to continue to do this till we can get this vaccine and get well into the summer next summer, and hopefully things will look much different. When we talk about the vaccine, We believe that the first vaccine that will come out will be Pfizer's vaccine, which is a 2-dose vaccine, and it is ultra low storage. So it has to be stored at minus 70 degrees. We expect that we could realistically have that vaccine in the state as soon as mid to late November. So we are working very, very closely with the CDC and OWS, the Operation Warp Speed, to make sure that we have identified where this vaccine can be delivered, where we have that ultra-low cold storage, and really starting to allocate where we will have vaccination sites. Many of our hospital systems have stepped up and raised their hand and said, we are willing not only to vaccinate our own employees, our own personnel, but we will vaccinate long-term care staff, and we will vaccinate EMS and other individuals. So we really have a great partnership with our hospitals, and even at a time when they are already very stretched thin, they're really standing up to help out. The second vaccine that we think we'll get will be the Moderna vaccine, and that will probably be in a mid-December time. Again, as you said, Sherry, there's no EUA for either of these vaccines yet, and none of this has been submitted to the FDA, so we will still be waiting to see that documentation as that's been given to the FDA and they provide an EUA. And we're also still waiting to see the ACIP's recommendations with regards to allocation of the vaccine and who the vaccine is actually effective on and has been tested on.
Yeah, Sherry, I would just say you threw out some acronyms there that had to be explained to me. Emergency use authorization. And,
sorry about that.
Yeah, but Sherry, I would also just say that your question reminds me of a conversation I had earlier this week with Governor Beshear and Governor DeWine, and we were talking about where these cases originate in Indiana, in Ohio, in Kentucky in this conversation's case, but this is happening all across America, in fact, all across the world, and where we let our guard down. And oftentimes, as I've said before, it's the safest place to be is at work or at school, but then what? And so often, folks kind of start to get religion after it gets really close to home, and where the cases, the positivity rate starts to get almost unmanageable or out of control when you start to go into that red. And then that's where that education also goes into enforcement. And what we are seeing are counties around the state of Indiana, more and more so. I've been on the road a little bit over the last week, and I make a point to look at every single storefront to see if there's signs up, because that's just encouragement. It's education for sure, but it's also encouragement that we can control only what we can control. And that can make a huge difference to our healthcare whole network and system and the number of shifts people are pulling. And if you're low on docs at the hospital and the cases in our long-term care centers. So our whole posture is, let's be proactive, not reactive. And the way we can do it, I know that masks are just one example, and they're a hassle. And my glasses fogged up earlier today when I was up in Northwest Indiana. But it's a very small price to pay individually to, in turn, keep our businesses open, keep our schools open, allow for that learning and commerce to continue. And, oh, by the way, save some lives along the way as well.
Max Lewis, WSBT.
Afternoon, Max.
Good afternoon, Governor. Can you hear me?
Loud and clear.
Okay, great. I was just wanting to know, up here in St. Joe and Elkhart and a lot of our surrounding counties, our hospitals have made it very well known that they are really struggling, and most of them are operating at capacity, delaying elective procedures, even moving patients to other outside area hospitals because they just don't have the room. I'm wanting to know, local health officials have said, we just got to message better. Well, they've been dealing with this for 2 weeks. The messaging doesn't appear to be working. How much longer do we go on without maybe, moving back a stage or taking more drastic steps, I guess?
Well, we'll continue to do, and I'll kick it back over to you, but we'll continue to make sure that we have the right PPE levels. We'll make sure that we do continue to educate and encourage those personal best practices, mask wearing, physical distancing. I know I sound like a skipping record, but these things matter. We'll continue to do more and more testing, as you heard Dr. Box articulate earlier today. We'll continue to rely on our tracing, and the better data in, the better data out. The better we can do our jobs, and the better we can micro-target where we need to send resources so we're not spilling them or wasting them. And then, obviously, as you point out, Max, we're constantly evaluating our capacity to care, whether it's got to do with staff, rooms, vents, et cetera. And with that surge, that you might talk a little bit about the difference of capacity right now and surge capacity, because just as Max said, moving patients around or deciding not to do certain elective procedures, these all factor into our capacity to care.
Right. So as we found out in the spring, but by canceling some basic elective procedures, oftentimes orthopedic procedures or other things, it does open up medical surgical beds that allows hospital systems to care for patients in their medical surgical beds. Hospitals now say they are at or near capacity, and that is their baseline capacity. We do know in the spring that they added a significant number of beds, which we called surge beds, which we are hoping and praying that we don't have to use. So the ability to add additional rooms and beds is certainly there. We still have plenty of ventilators and the ability to do that. I think the biggest thing is I've had regular conversations, and I know Dr. Weaver has had very regular conversations also twice a week with South Bend, St. Joe area, is they're concerned about staffing. They're concerned about their staff burnout. They're concerned about the fact we're going into holiday times when everybody wants to have some time off to spend with their family and to relax a little bit. And there just doesn't seem to be a break coming at this point in time. And it's not easy to get staffing. So those are the things that we're really working with and continuing to work with them on. I do know that the health officers in St. Joe County have been very proactive, very strong in their messaging, very clear, even that they've had several outbreaks in churches up there from individuals that got ill. And really, they have been very straightforward in their messaging, in that they need people to be social distanced. They need people to not be in large groups gathered. They need people to wear their masks. And even though, Governor, you say it's all we can do, it is a major thing. Yeah. It is the most important thing we can do, and that is the way we're going to get this back under control.
And we have to do it. You know, Max, you asked how long do we do this? As long as this virus is with us, we're going to have to do this. And I know sometimes it sounds like pleading and begging, but we're going to continue to respond with resources and help on that front as well. But we need individuals to understand that their actions have consequences too, or their inactions have consequences. And anything that we can do, including this most important thing, is going to help your community get through this and stay up and open.
Whitney Downard, CNHI.
Afternoon, Whitney.
Good afternoon, Governor, Dr. Box, and I'm so happy to hear that Dr. Dan's on hand too. I've got two questions. The first question I have is that the CMS has set up a specific guideline for how often and frequently staffers at long-term care facilities should be tested, and they sent out all of those rapid test devices. Is that testing plan just not working? Why didn't it catch this surge of cases before it began, and how can we adapt the testing plan to prevent this?
I can't see Dr. Dan sprinting to the chair, but I know he is.
He's probably taking his mask off as we speak.
Yeah. Thanks, Dr. Dan.
No worries. Good to be back. So short answer is all the facilities in the state of Indiana are abiding by that CMS guidelines. I think we're going to have to look at this over time. We saw, for instance, when a lot of colleges started and were doing a lot of proactive testing, that early on they identified a lot of cases, and that by continuing to do that weekly testing, and over time reinforcing those infection control practices, we were able to see in specific colleges a lot of the positivity rates significantly drop. I'm hopeful that we're going to see some similar trends in long-term care, that we have identified a lot of folks early on. We know there are big outbreaks as well, but that through this kind of continual testing, we're going to be identifying more folks working in long-term care facilities earlier, particularly those that are asymptomatic, and hopefully see with that decreasing outbreaks.
Whitney, did you have a second question?
Yes, I do. So kind of actually repeating a question you've gotten already. Was there something that we could have done earlier, or a way we could have been proactive earlier? Specifically, why are we sending the National Guard in now when we knew about the staffing problem before the pandemic? Should we revisit our visitation guidelines that we gave nursing homes? What are some of the ways we could have been proactive earlier?
So, and I'll let Dr. Dan weigh in on this, but we to date have not identified that any specific cases have come into these facilities based on the fact that somebody's family member came. I mean, my mother-in-law's in a facility and we don't get any closer than 6 feet. We have to have our masks on. We're still outside even when it's 55 degrees and a little bit rainy. So we're really, if other facilities are running their visitation that way, I do not think that's the way it's coming in. But it is incredibly difficult to prevent that from coming in with other individuals who are coming in to either work or staff these facilities, even if they're physicians that are coming in and out, or the CNAs or the nursing staff, when we have a high community spread. And that's really been a significant issue. I think that the increased masks that we're giving them, the goal is not only to protect our staff in long-term care facilities, but should they be asymptomatic positive, and these tests that are being used not picking that up, which certainly, in my family's case was one perfect, fact that none of the point-of-care tests picked us up. It was only the nasopharyngeal swab run through the lab that picked it up. But if they would be asymptomatic positive, having that equivalent of an N95 on would help to decrease that spread to anybody in the facility. Dan, did you want to add anything?
I think you covered it really well. The only thing I would add around the National Guard is, in part, we have been looking at addressing staffing shortages the whole time. Right now, though, we're looking at the highest rates we've seen in the community, and with that, also a lot of with the proactive testing point of care, a lot of identifying a lot of staff who then have to go home and quarantine. So really, I think right now it's just the right timing in terms of both community spread, the point of care testing, to try to help utilize those to do what we can to offload nursing home staff so that they can really do the work that needs to be done, which is patient care.
And we had also heard realistically that they're having to test so frequently, and it is such a burden to document and record all of that information, that it was taking personnel away from actual patient care or resident care. So by bringing the Guard in to help to do this, to do some of the screening at the front door and screening of the staff when they come in, wiping down those frequently touched areas, this will just be a little bit off of the long-term care facility staffing plan so that they can direct that toward their residents.
And part of this is plus 30 days ago, we were doing surveys throughout the state of Indiana through our long-term care centers that Dr. Weaver talked about. Just completed, yeah. She talked about that last week.
Jody with WRBI.
Afternoon, Jody.
Good afternoon, Governor. Thank you for taking my question. Sure. So locally here in southeastern Indiana, one of our health departments has taken over doing localized contact tracing again, with the recent surge in cases in the area. And they are reporting that they are having people tell them that they're having people being told that are sick not to report to contact tracers. They're having people that are sick going out to businesses and to the nursing homes. How can we convince the community that this is still a serious issue, even though they're all just as tired of coronavirus as the rest of us?
Right. You want to talk about the information that we're seeing as well that
right.
matches with that?
And I didn't want to use this because I don't want it to look like an excuse, but we are seeing an increasing number of people who are just like, not going to help you, not going to give you information, not going to quarantine, not going to isolate. We're just not going to do it. I think they're tired of it. They're over it. We also hear that people don't want to get their family members tested because they're worried if that individual comes back positive, then the older brother who maybe is a quarterback on the football team, or the sister who's on the swim team, or mom or dad can't go to their job, which is, critical in their life. And I understand that. Believe me, I understand what it's like to turn your life upside down and stay in the house for that length of time. But it is worth it. And it is a part of what we can do as Hoosiers to try to protect other Hoosiers. It's something only you, if you test positive, can do, is to help us actually identify other individuals who could be at risk for becoming positive, and maybe even be positive and not be aware of it and be infecting other individuals.
Dan Klein, Wish TV.
Afternoon, Dan. You are live on TV, Dan.
Dan, you should be able to unmute your own microphone. We'll come back to Dan. Leanne with the Daily Journal.
Hello, Leanne.
Well, we'll just keep going down the list. Brandon Smith, Indiana Public Broadcasting.
Afternoon, Brandon.
Afternoon, Governor. I wanted to follow up about voting and your insistence that it's safe, but we've also heard county clerks who are refusing to enforce the mask order, whether for voters or even their own employees. So why shouldn't Hoosiers be concerned about the risks they might face at their polling place?
Yeah, well, they should be concerned, and they should mask up, and they should physically distance. We've seen hundreds of thousands. That's my insistence, that I'm just observant of what's occurring. And you are able to vote safely, and you have to take precautions. And you can vote, early or on election day, your final option on November 3rd, and you can do either safely. It's occurring right now to the tune of over 1 million, by the way.
Meredith with WLFI.
Good afternoon, Meredith.
Good afternoon, Governor. Glad to see you back, Dr. Box, making a full recovery. So I know this was addressed partially at the beginning, but I was anchoring this cut-in as it was being asked, so I apologize if it's a bit of a repeat. But so is the National Guard being deployed to Tippecanoe County, which is our area, and how bad does a facility have to be that first tier of long-term care facilities that is being deployed to, and how is that determined? And then I do have a follow-up question.
Sure. You want to go through, an outbreak is one case, by the way.
So we might want Dr. Dan to come to the microphone too, but I would start by just saying that we really are looking at facilities that have higher numbers of not only residents, but staff that are infected. And specifically, if there would be a facility that raised their hand that said they need help. Dan, do you want to?
No, that's correct. We looked through facilities around the state that were involved with active outbreaks and really kind of tiered those based on those needs. I don't know off the top of my head whether one of those is in Tippecanoe County, but we can certainly look at that list. And then that second tier, again, related to outbreaks, and then the third tier. But I think what's most important is that within 3 weeks, we really hope to have Guard in all the facilities around the state. So we know that this pandemic's going to change week to week, and so we just want to make sure we get them everywhere.
John Russell, the Indianapolis Business Journal.
Afternoon, John.
Good afternoon, Governor, Dr. Box. So with the ongoing surge, many Hoosiers might be wondering where exactly these outbreaks are occurring. Beyond the county level, which you publish on your dashboard, zooming in more to the exact sites, the various gyms or event centers or churches or business conference centers, and showing how showing how it's spreading from there. With all the information you're collecting and contact tracing, why don't you offer pinpointed or even zip code level data to show the clusters of COVID cases? Equivalent to what you're showing with long-term care facilities and schools.
Yeah, you want to talk about just the the balance of volume and accuracy?
So there is a tremendous volume, as you know, of positive cases that are coming in right now that we are looking at, and we engage very closely with the local health, local public health to investigate these further. We do share many of those specific sites that we find out about with the local health individuals, and they are investigating them further. We don't publicly announce certain businesses or so-and-so's wedding or so-and-so's funeral, but we have been tried to be very clear about the fact that many of these are gatherings that are neighborhood gatherings, family gatherings, not usually even the large gatherings. We haven't seen the significant cases oftentimes from that, but times when we tend to be with those people that we're closer to and that we spend more time with and do tend to let our guard down. But we do work with our local public health to talk about those cases, investigate those cases, and share those cases with them.
Brenda with Western Wayne News.
Afternoon, Brenda.
Good afternoon, Governor and Dr. Box. Welcome back.
Thank you.
I just wanted to ask if you could be any more specific about the outbreak in Fayette County. I know that there is at least one long-term care facility that's had an outbreak, but I wondered, to take them to red, I wondered if it's a little deeper than that and you're able to elaborate.
Yeah, I know the local health officer there very, very well. He and I went to medical school together, and I think he's a wonderful man. And he and I and Pam Pontonis, our state epidemiologist, have had discussions. The long-term care facility only accounted for, I think, about 20 or 25% of their cases. So it really didn't reach that level where we would asterisk it, where it was 50% or more of the cases. In talking with Dr. White, he says there's just not a desire there or a heart to wear masks, that he sees people not social distancing, not wearing masks, and just not taking it seriously. So he really struggles with being able to get that message out and to get people to really buy into the fact that this is the way they're going to help bring the spread down.
Taylor with the State House File.
Afternoon, Taylor.
Good afternoon, Governor and Dr. Box. My question was, sorry, one second. I was wondering if you think that President Trump's carelessness regarding COVID-19 is sending the wrong message about the seriousness of the disease, and if it undermines what you and Dr. Box have been encouraging with all of the best practices of wearing masks and social distancing.
Well, I'll speak for myself. From day one, Dr. Box and I have been very clear about steps that work, and we'll continue to be crystal clear. And I encourage Hoosiers to be in touch, not just with us, but what's going on in Indiana, and really your local health departments as well, like never before in the last 100 years. And we're starting to see those local health departments in rural, urban, and suburban counties get more and more active because, the cases are going up. And just when you think about kind of the theme of today's conversation about how long will this go on and what more can we do, again, this is what every governor across the country is having, this very same kind of family discussion about what more can we do. It's up to us individually, and what we're asking is don't wait till it's too late, because it's coming, it's there, the facts are clear. And if it's not in your neighborhood yet and folks are careless, it will be, and it will be at a greater rate. And so that's why I'm asking folks to go to our website, go to the Department of Health's website, get your information there on a daily basis. You don't have to wait for every Wednesday at 2:30. We're updating this on a daily basis, and the facts are clear. And then also be in touch with your local health department, maybe like you've never been before.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.